I'm Dr. Jacob Thomas. I'm the President of the Association of Private Hospitals in Malaysia. I'm also the Chairman of the Ramsay Sime Darby Healthcare. I'm a medical doctor and I reside in Kuala Lumpur in Malaysia. See, when we look at healthcare around the world, they're all going through various forms of transformation. And one consistent mode of transformation is talking about how they can get involved in a one healthcare system. That is, where the public sector and the private sector work together. So some form of public-private partnership where patients in a country can choose to go to any hospital of their choice, irrespective of affordability, and this is a universal system of healthcare which is being planned out. Now, if you look at countries like Australia, it has existed for many years. It has worked very well. You can see a public hospital and a private hospital side by side, sometimes even linked with a bridge. And for doctors to practice in both sides and even transfer patients this way or that way, depending on the need, depending on affordability, depending on the speed of service which is needed. And these are models which has worked very well, and many countries are looking at systems like this. Having said that, it's difficult for any country to cut and paste a system to suit their own, because there are so many variances. Differences in culture, differences in the type of services which is available, the sophistication of healthcare. So all this plays a role in deciding on a country. Now, if you look at Malaysia, we have a very good public system which forms about 70% of the healthcare in the country and 30% on the private side. Now, the government has said that they cannot afford to provide this heavily subsidized 70% much longer because it's costing them a lot. So they are looking at the 30% private sector to work with them to together provide service for the citizens and the others who are in the country. And this is something which is beginning to get a lot of interest. Many studies done how to merge these two sectors together have not succeeded. At the moment, the government has embarked on asking Harvard University to do a study. And I believe that they are at the verge of coming up with some form of partnership between the public sector and the private sector, which will together enable every single citizen and patient in the country to get care. Now, if you look at India, Indian system is also very, very sophisticated. Not just the distribution of hospitals around the country, even in the remotest of locations, but also the distribution of doctors and nurses. I've always believed that India has a good standard of healthcare because of the experience and the highly qualified doctors, the specialists that you have, and some of the surgeries and procedures done in hospitals here talked about in the rest of the world. Not only the public sector and the private sector, but I also understand that there's an equally prominent and credible armed forces hospital system as well, and that is also something which we have heard about. Now, the way in which these hospitals work together is also, I understand, something which is under very close scrutiny, and the government of today is looking at how these two sectors can be brought together, and how any system where a patient chooses to go to will be affordable. If not being paid for by from your own pocket, maybe it's by co-payment or payment by insurance companies, which is subsidized by your own contribution as well. You see, the whole thing revolves around, I think what we need to emphasize globally is healthcare is not a government responsibility, although government assists, but each individual has to take responsibility for his health. It doesn't mean that you don't care for your health, you become very ill, and then you look to the country to provide. So we need to take responsibility, be healthy, have a healthy lifestyle, try and prevent non-communicable diseases, comorbidities. That way we find that the stress on the country and the country's budget will be reduced by you taking care of your health care. So these are initiatives taking place. If you look at Indonesia as another country in the region which is very close to us, they have started a universal health care, and the government will pay a certain amount for treatment private hospitals provide for a patient who is registered with a particular national insurance. The payment rates are very low, but the government is periodically reviewing that. So the payments are low, but the volume of patients is high, so this becomes attractive for private hospitals to embark on this, because you have excess capacity. Instead of leaving a hospital bed empty, you might as well fill it up even though you are getting reimbursed less. We have a similar system in the Philippines as well. There's a national insurance called PhilHealth. They also provide services to patients who want to go to a private hospital, and those are public hospital rates but with a little bit extra for the private sector. So these are various initiatives in the region which works for different countries. Sometimes it has to be tweaked a little bit to suit the private sector, to make sure that they don't lose out by being involved in such public-private partnerships, but at the same time helping the country to provide reasonable cost health care to the entire population. I was personally, I studied medicine here in India, and I know the Indian healthcare system quite well, and I've worked in a public hospital in India. I've seen the professors and others in the private hospital attached to the medical school I was involved in, and I've seen the caliber of doctors, and I've seen the caliber of doctors, the wealth of experience our doctors have, and I think not many other parts of the world will give that kind of experience and skills for training for doctors. So as a result, you find today India blessed with a big number of medical specialists, not only specialists for basic care, but also for specialty and super specialties. We talk about liver transplantation, we talk about cardiac transplantation, we talk about beating heart surgery where you don't have to stop a heart when you do a cardiac bypass. Now all these are advances which many countries struggle with, but we hear doctors in India doing this on a regular basis and doing it with excellent outcomes. Now it is not just a matter of doing the surgeries, but the outcomes are fantastic, and this is what sets India apart. And when you talk about what is the public system like, yes, it's crowded. You are talking about dealing with the masses. We know the population in India is one of the largest in the world, so we have to deal with large masses, large numbers of patients, and we have to triage and privatize. I think for the number of patients treated in the public hospitals here, they're doing a fantastic job, and that is why the pharmaceutical industry in India as well is huge, because